Welcome back, everybody. The conversation around the Falcons quarterbacks, they continue. This time, it happens to be about Michael Penix Jr. ending his season because of yet another ACL injury. And it's time we bring in the experts to talk all things ACL and the future of Michael Penix Jr. So we have Dr. Mark Amirtharaj here, sports medicine surgeon at HSS. Mark, thank you so much for joining us.
Absolutely. Thank you for having me.
You have so much experience in professional sports, the NHL, MLS, and the NFL. When we're talking about a starting quarterback in the National Football League that's going to need to be out for the rest of the season, now with another ACL surgery, this time on his left knee, what's a typical timeline for something like this?
Yeah, so I think before we kind of get into timeline, I think it's important to note that, for the most part, most of us are outsiders looking in. So we don't quite know all the details of, maybe he had an ACL injury, but, was there a meniscus injury? Was there a cartilage injury? So some of these injuries can be pretty variable and complex, and all of that can kind of go into affecting the timeline after a surgery. But if we step back and just talk about the ACL injury itself, generally what we say to patients is, especially for high-level athletes, as long as the rehab goes well and there aren't any major hiccups, we generally look at about a 9-month timeline to get someone back to sports after ACL surgery. And again, that's not a hard and fast rule, but it's just, if you look at the bell curve of all high-level athletes that come back from ACL surgery, the average tends to be around 9 months. If it's a more significant injury, it can be a little bit longer. So that's generally a time frame we talk about. Now, you bring up a great point in the fact that he's already had a couple ACL injuries on the other side in the past. And actually, when you tear one ACL, you're actually at a higher risk for tearing the other ACL as well. And so, for whatever reason, he's just been at a higher risk for ACL tears and unfortunately has another season-ending injury. Now, that can be a good thing in that he's already very familiar with the rehab and knows exactly what it takes to get back onto the field, and he's proven himself over and over. But it can also be a very difficult thing because mentally that can take a toll on an athlete. And so I have no doubt that the Falcons medical staff are doing everything they can to get him back on the field. And at HSS, we work very closely with the New York Giants. And so, part of our training, we work closely with the medical staff, the athletic training staff, and you get a really incredible glimpse into the resources and sort of the time that all these professionals put into getting these athletes back.
You mentioned there's a lot of time, effort, energy, and resources put into it, and people like you on your team doing the same thing that the Falcons are doing to hopefully get Mike back on the field. But at what point is there a level of concern and recovery and the future at the position when, as we're discussing, there are now multiple surgeries for Michael at this point?
Yeah, I mean, there's always concern that, there may be a little bit more complex rehab now that he's had sort of multiple surgeries too on the one side and now on the current side. And so there's always a level of concern that, with every injury, is it going to be harder to get back onto the field? But again, I think, these guys are really special human beings in that they really figure out a way to rehab through things that would put you and I out for good. And so, I think between the Falcons staff and, Michael's surgeon, I think he has a good chance to kind of get back.
This is an outsider looking in question, and for people who don't understand what it's like to recover from ACL surgery, you mentioned Michael is very familiar with this. That is the big positive here. But is there any perhaps level of concern when you have two injuries to your right ACL hindering the recovery time now that he's dealing with yet another surgery in his left knee? Is there any level of concern there?
I mean, again, there's always a general level of concern because now he's dealing with multiple things. But I think the point is, he had the other couple ACL tears in the past and rehab successfully back to the field from that. And again, outsider looking in, it's always hard to know what level of symptoms or issues he's been dealing with that reconstructed knee. But the fact of the matter is he made it back to the NFL at the highest level imaginable, and played, a good portion of the season until this unfortunate injury occurred. And so, Again, I think there is always going to be some level of concern, but if anyone can get back, it's someone like Michael.
I love that, and I love being positive about it, especially because ACL surgery and recovery has come a long way, especially with professional athletes. What are the long-term implications of a torn ACL for a professional athlete?
Yeah, so the first and foremost goal of ACL reconstruction in a professional athlete is to restabilize the knee so that they can get back to high level cutting, pivoting, elite performance. That being said, there are consequences to the initial ACL injury and then the surgery itself. And one of the things in our field within ACL surgery that we still haven't quite solved yet is the issue of post-traumatic osteoarthritis, meaning that you have an ACL injury, we restabilize the knee, you get back to sports successfully, but long term, when you look at 10, 15, 20 years out, knees that are ACL injured are just at a higher risk of developing arthritis quickly. And so why that is, I think it's multifactorial. We haven't quite, as a field of surgeons, we haven't quite figured out the solution to that and how to prevent that. But any ACL injured patient, not just professional athletes, I think that's in the long-term timeline, that's something to keep in mind that may or may not happen.
There's a lot of people listening too that are not professional athletes that have had ACL injuries that are listening exactly what you're talking about and understanding what you're talking about as well. Lastly, the Falcons also have a star wide receiver, Drake London, dealing with a PCL strain. Falcons have said he's week to week. Explain exactly what a PCL strain means and what that recovery process may look like.
Yeah, so with PCL injuries, it's a very different beast than ACL injuries. So the ACL and PCL are two ligaments in the center of the knee that are cruciate ligaments, meaning they cross each other. So the ACL is in front, PCL is in the back. Now with PCL tears, oftentimes in athletes, again, outsider looking in, so I don't have all the details on his exact MRI and his imaging, but when you talk about PCL injuries in general, a strain is on the spectrum of injury in terms of you can have a grade 1 tear, grade 2 tear, grade 3 tear. Obviously, the higher the grade, the worse the injury. But many PCL injuries can actually be treated non-operatively without a surgery. And so why that is, there's some intrinsic differences in terms of each ligament and the role that they play in terms of stabilizing the knee. And PCLs are just generally more likely to be able to heal and let someone come back to full play or activity after a course of non-operative management.
Dr. Mark, thank you so much. This is, of course, the most unfortunate part of professional sports when athletes are injured and can't get back to doing what they love to do the most. Dr. Mark Amirtharaj, thank you.
Absolutely. Thanks for having me.
We'll be right back.